All right.
I apologize. My back went out on me on Sunday. Otherwise, I'd be up and moving around like Zeb here.
All right. So we were asked to talk about a very important topic that's very near and dear to our heart around maintaining resiliency with third-party service providers. Because if you're in IT and you've been in this room, I know that most of you have probably experienced this at least once this year, right? At least once. So we're going to talk a little bit about that. But I'm going to introduce Dwayne, and Dwayne's going to introduce myself here. But Dwayne and I go back 5 years. I actually hired him at VCU Health 4 years ago as the manager of network services. So him and I have developed a very close, very tight friendship over the years. He spent years in the Army. He actually got to do the fun stuff and blowing stuff up, you know. He served as a tank commander, and he has provided valuable service to our country, and we thank him for that every day. But from there, he moved into network services with Ferguson, and then he decided he got tired of dealing with toilets, and he wanted to come and work in healthcare. And I said, "Are you sure you want to do this?" All right? And I will tell you, the first question that I ask every single candidate that interviews for any job in healthcare with me is, what do you think you're signing up for and why do you want it? Because I figure if you can articulate that and tell me why you want it, then that's probably a good basis for a conversation from that point forward. And Dwayne did a really great job with that because he wanted to help people, right? And that's what we do in healthcare. It's a very people-oriented business and helping take care of folks, both physically and mentally. So Dwayne joined the team, and him and I have worked very closely together ever since. Even post me moving to UVA Health, him and I still talk rather frequently. So, Dwayne HIMSS.
And this is Zeb Elliott. Like he said, 5 years ago we met, and as my prospective boss, I did a little bit of research on him. Zeb actually holds 2 master's degrees, one in MBA, one MSIT. He also was getting his PhD at the time, which I just thought was, wow, phenomenal. On top of that, he was teaching at VCU networking and IT classes. Also on top of that, I reached out to a couple of our common interests, and I said, how is he? Is he a good person? Because that's really what you want to look for, right? Someone is, your boss is normally responsible for a good portion of your sanity, and I wanted to make sure I was working for a good guy. Everyone said Zeb is a good guy, and that he is. He's a great person, genuine, and honest with you. So Zeb was the director of infrastructure at the time. After our CIO left, he got promoted interimly up to CTO, and then from there, as he mentioned, he's already the CTO of UVA Health. I do know one cool thing about Zeb. He loves Christmas. If you've never been to his Christmas light show, I don't know if you're going to do it again, but if he starts it back up again, you have to go. He put on Santa Claus shows where people came and did their thing for Christmas, so he loves spreading that joy at Christmas time. That's Zeb pretty much in a nutshell.
Thank you, Dwayne. All right, so what are we going to talk about? We've got a few things to talk about. We stand between you and lunch, so I promise to try and make it somewhat interesting as we go through this. So we're going to talk about what are third-party systems. You know, what are some of those challenges? What are some of those things you're going to cause you to have a bad day? And then what can you do to mitigate that? Because let me tell you one thing here. If there's anything I've learned in IT is there are some things you can prevent and there are some things you cannot. And how third-party systems operate within your environment, they're made by humans. Humans can have a bad day. One network engineer that fat fingers a DNS entry for a time to live of 24 hours can make you have a really bad day, right? So these things are going to happen. But what you can do is choose how you and your team are prepared to react to those instances. And that's what we want to talk a little bit about based on our own experience today. And then we're going to talk about balancing the needs, and we've got an example scenario to walk through and some lessons learned that we have both learned from that.
So what are your third-party systems? Where do they come from? A lot of us use as a service, so IaaS, PaaS. I've even seen XaaS, anything as a service. These are your third-party vendors. We rely on them in our industry because they can do their job better than we typically can get someone in-house to do. So anything from your EHRs in Epic to your ERPs Workday, the elephant in the room 2 months ago, CrowdStrike, Microsoft, all of these vendors you have to have a relationship with. You have to build that relationship. And there's pros and cons to that. Some of the things that we're going to talk about, next slide you'll see, is how can you have a bad day with your third-party vendors?
My turn?
Your turn.
All right. So there have been 3 instances in my career where I've had really bad days because of third parties. And I'm going to tell you about all 3 of them, okay? Are you ready? 2 of them are third parties, and 1 is completely preventable, but some of you will be able to relate. The first one is expired certificates, okay? Anybody ever had that issue in your environment as an IT person? Yes. Those cause you very bad days because while entirely preventable, right? We forget. And we forget to renew them. And then all of a sudden you get a call at 12 a.m. one night when all of your wireless PKI infrastructure is offline because the certificate expired, right? That's a bad day. Or your entire Citrix environment goes down because a wireless certificate expired or a certificate expired. So that one's completely preventable. Not necessarily third party, but still, bad day. The second one was a third-party blacklist update with Palo Alto. Anybody use Palo in here? I love their products. Great firewall. And usually most information security folks are going to subscribe to third-party blacklists that auto-update to put entries into the system to say, hey, you need to start blocking this. We know it's a bad thing. Block it, right? Pretty straightforward. Well, had one of those updates come in. This was while I was at VCU Health. Dwayne and I lived this together. And it completely crashed both of our edge firewalls. Our health system was isolated from the internet for 48 hours. 48 hours. We were isolated from the internet. We happened to have brand new Palos in a box in the data center. Rebuilt them, put the operating system back on it, crashed again. The only way we figured that one out was we loaded each individual module and component of the Palo Alto operating system and third-party subscriptions one at a time until we found the one that crashed it. Then we found that we stopped that. We didn't do that again. And we reloaded everything but that, and we were back up and operational. Third-party update, right? How do you even prevent that? The answer is you can't, right? You can't control what third parties are interjecting into your systems. And the last one was the most recent one. At UVA Health, I refer to it as the event, right? The event. It was the weekend event is what that was. And that was nothing that we could prevent either. By the time that we got the calls and we started waking people up at night, we had 17,035 machines out of 22,000 plus machines that were impacted by that event. And we're going to talk a little bit more about that. But third parties can impact you whether you think you're prepared for it or not. You cannot necessarily, unless you don't want to take advantages of the updates that those types of services provide, right, in real time, it is very hard to prevent those things from 100% happening 100% of the time. So that's why we want to talk about, hey, what have we learned and what have we seen and what have we started to do to help make that better. But these, as the slide says, the things that can get you are those unscheduled updates. Anybody ever had a Microsoft Windows patch take you out? Yeah, I see some heads nodding. Yeah, Microsoft patching is famous for doing that. Dynamic updates, 0 days, right? We have those events that come out. The inability to throttle those updates and say, hey, when it comes out, it rolls out to everybody. CrowdStrike, we had set at, 500 machines a minute? Kind of hard to stop that and figure out what's going on before you have a pretty significant event. And if the vendor doesn't do very good testing or piloting of their services, they just think, hey, it's good to go. Let's roll it out and see how it reacts in our environment. And then there's always urgency, right? We've seen something in the wild. So I served as the information security officer for UVA Health for the last 8 out of my 10 months here. Change Healthcare hit me on the second day as a new CISO. That was fun. But we've hired a new CISO now it's all his issue. But urgency, right? You're always calling up. Let's get the infrastructure. We've got to patch a server now. We've got a critical update that's come out. These are things that we absolutely have to react to, and there's not always time for testing, right? And that's where we get ourselves into trouble.
So what are your tools for success if an event happens? How do you get there? How do you start resolving it? How do you fix it? So one of the things is culture, and I've dubbed it as hero culture. I'm sure other people have done it that way as well, but it's one that's stuck in my head. It's those people that won't go home. It doesn't matter if you kick them home. It doesn't matter if they have things to do. It's the people that are staying and doing their job because they know what they're doing matters. Especially in healthcare IT, we know what we do matters. We know what we do enables the doctors and nurses and clinicians to treat patients. What we do is an enabler. So that hero culture was a key success for the event that we're going to talk about. It's creating that culture in an environment where people want to come to work, people want to succeed, they want to know what their job matters to the people, ultimately our patients, right? So hero culture, I've had 2 or 3 employees, I've literally had to kick home. They've worked a 65, 70-hour week. They are exhausted, and we had to kick them home. In this event, though, the hero culture came through. We had over 200 people out of the 400 IT people voluntarily, not ordered, not mandated, not supervised, said be on site. They voluntarily gave away their weekend to help troubleshoot the CrowdStrike issue.
I cannot emphasize that point enough. Every last one of you in this room are responsible for the culture in your organization, right? You contribute to it, or you condone it, or you support it, whether it's good, bad, or indifferent. Unless you do something to change it, you support it, right? Your culture in your organization matters for your IT folks, too. I'll tell you one thing that I like to do at UVA Health every time we have a team meeting. And I do all hands meetings with all 200 plus of my folks every month. And there's 2 things I start off with every single meeting, and they probably get tired of seeing them every single meeting. But the first is a focus on our mission. What are we here to do? And that's to make our clinicians' lives easier. That's what IT is here to support, is to make sure that our clinical folks have the tools and the technology and the things they need to take care of patients. If we make their lives harder, we are failing. Period. First slide. The second slide to that is let's share an uplifting moment. Because you need to hear the good stories that go along with the work that you do. Because that forms your culture. That forms a cohesive bond with your folks that when the crap hits the fan, you need them to show up. Right? That's what we need. So setting that foundation of that culture, letting them know where you stand, what you need. And there's 3 words that I've got for you. And this is something that I do internally. My folks at UVA Health have never heard me say this, but this is something I try and practice. And I try and practice open accountability with grace. Everybody hear that? Open accountability with grace. And the grace is a very important part of that. You know why? Because people make mistakes. We all have bad days. We all have great days. But when the bad day comes, and people made a mistake. Maybe they didn't communicate quick enough. Maybe they didn't call the right leader to bring to the table fast enough. We can sit here and armchair quarterback a problem all day long, right? But that's where the grace comes in. We have to know and instill and show people that we value what they're doing and they want to do the right thing. They might not always get it right, but we want them to try to get it right for the next time. And that's where the grace comes in. We have to show that. Command and control. Now, this is kind of funny that I'm covering command and control and the Army guy isn't. So Dwayne knows all about this being in the Army, and I served in the fire service as a firefighter EMT for 6 years. So command and control is very much ingrained in our 2 lines of work here. And you have got to have good command and control for reaction to a third-party incident that involves a wide scale, right? Most of us, I would say, have really good processes and procedures for major incidents. Would you agree? Most folks have a major incident manager. You know you got to get on the call. You know you got to get the right folks. And it's usually very limited in scope. Let's say Epic is down, right? Big incident, but generally limited in scope. You can bring the right people to the table to fix that. 17,000 machines encrypted, or not encrypted, or crashed, where you don't have enough endpoints to be able to take care of patients, that's a whole different scope, right? So understanding what roles you need. Have a ransomware event, and you have major encryption throughout your data center or throughout your environment. That's a much different scope than, Vocera is down. So your command and control structures look different when it's a major incident or a catastrophic incident versus a normal major incident. So being able to know your role and practice for those. Being able to partner with hospital operations quickly. I cannot emphasize that enough. When that hospital command center comes up with all of those operational leaders, having the IT folks or an IT person that has some knowledge of what's going on and being able to pull in the right IT folks and ask questions in the command center is key, right? We had 3 command centers during the event, right? 3. We had the hospital operations, we had our community health operations, which are our smaller community hospitals, and we had our IT command center. And then we had sub-command centers behind that were doing very specific focused operations, whether it was ambulatory, whether it was our main university hospital, and so forth. So being able to understand command and control and having people train and execute and talk about it. What are we going to do? How are we going to execute? Is very, very important. It saved us so much time.
One of the things we were talking about is if you're in an incident and you're worrying about setting up your incident response team, you're way too late. You should be practicing incident response. You should have your incident managers ready to go. There should be training involved with it, right? So if you're already in the incident and you haven't practiced it at all, if your major incident manager can't spell network, you have a problem already, and these are things that you should be addressing before an incident even happens. Looking at disaster recovery, which is one of the things we're starting to bring in and bring up and fill out. Disaster recovery plays a pivotal role in it. And like Zeb said, communication with your ops center or your operations team was pivotal. We stood up our command and control right in the hospital, right at the main floor where the cafeteria was. Field services came in, stood up all the computers that were needed for command and control. They got rocking and rolling within, I would say, 2 hours of getting notified of the incident. So all of that was practice procedure that we had already had in place and were up and running.
One thing that we learned the hard way on that is resource mobilization. Having a automated way to mobilize resources. I don't think that's something that we normally think about in an IT perspective, an automated resource mass mobilization effort. During the CrowdStrike event, it was at 1 a.m., right? It was after hours. That was fun. And I was getting all my directors and managers to the table, right? And guess what? The most valuable resource we had in the health system at that particular point in time was a desktop technician, right? Because they were the only ones with the access to fix stuff. How do I get them all out? They only have 2 at night. How do I get them into the environment, sent them to the right location, and start fixing things so that our folks could come back up? Now, Dwayne has a whole different approach because he got hit a little bit harder on that side. But resource mobilization, that's one thing I would encourage everyone to think about here, is how can you automate it, get your folks on a dialer, calling, saying, report to this location by this time. It's an emergency. Not something you take advantage of, right? But something that you have the ability to do where your managers and your supervisors aren't necessarily having to pick up all the phone, find all their texts, and start dialing and say, report in, while being asked to give updates on what the heck is going on. So.
And the last one on there is ingenuity. I always tell my team, like, I'll tell you the end point, but I won't tell you how to get there. I don't want to drive them in a direction. I want to be surprised. I want to be shocked, because sometimes you're more impressed with the outcome than if you actually gave it. In this case, ingenuity was paramount. We couldn't even get into BitLocker. We had our information security team find a way to get around BitLocker and start getting in and deleting the files that we needed to. I would have never thought of it. I would never even tried it. From sharing passwords to getting communications out, like Zeb said, Teams was down. People couldn't log onto their computers. How are you going to communicate with people? What are your resources? We went to a hard copy playbook, believe it or not. That's what we ended up going to, because everything else was on computer. So the ingenuity of how to get out of a problem and how to get to end state and how to get running is paramount, and relying on your engineers to do that.
Remember, sometimes in these events, in our minds, there's a box, right? There's a very hardcore set of rules that we must follow. It's okay with guided forethought to take an eraser out and maybe erase one of those lines so that you can get to the outside of the box to get your organization back up. We're going to talk a little bit about that in a second. But, for us, during that particular event, we had teams writing scripts. We had a team that was out fixing. They came up with a script. You put the USB, you boot the PC to it, you run this script. It looks up the BitLocker key in a database, unlocks the machine, deletes the file, and they go on to the next one. We got a restoration down to about 2 minutes per PC, so we were able to roll through them pretty quick. We bought out every USB stick in Walmart, Staples, and everywhere in the Charlottesville area, and I have 300 of them in my office. But we figured that out, right? And it was our network manager that figured that out. And our desktop engineering team and our security team figured out how to get our remote workers fixed by making a live change to our identity and access system so they could log in and get walked out through to get their BitLocker key to unlock their machine and fix themselves, right? These are things that you've got to empower your folks. And you need to think about that now. Where's the line, right? Where's the line of what you got to let them do now versus when you're in the middle of crisis and someone takes down or just says any on the firewall rule, right? We don't want that. For my network folks, any or non-network folks, putting any on the firewall means you're just letting anything that wants to come into your environment come into your environment. It's essentially putting down the drawbridge on your gates. So we want to be a little bit more prescriptive and think about that when we're of sound mind. Than where we're in the middle of a crisis and we just want to do anything to bring it back up. So being forethought is important there. Oh, there we go.
So near and dear to our heart, the need for operations versus the need for security, right? Where does that balance lie? How do you do it? We actually had our CISO, and I'm sure he'll deny it because it was 2 a.m. in the morning on CrowdStrike, said, I don't care about security, let's get everything up and operational. I highly doubt he would ever admit that he said it, but he did at 2 a.m. in the morning that morning. From anything from BitLocker keys to sharing the local admin rights. We have a local admin rights, only our field service team has it. However, that day, almost 200 individual IT people had that local admin password, and it was only to get us back up and operational. So where do you balance that need? How do you restore operations and keep in mind that you have security afterwards? What we did is we started documenting everything. The first one was the local admin password. The day after the event was cleared, we changed the local admin password. The day. BitLocker keys. We're having Microsoft come in and do a BitLocker health check just to make sure everything's up in operation, everyone has the appropriate BitLocker keys. So we realized during the incident in Restoro, as Zeb said, we had to erase that line and make sure that the hospital operations can still run. VCU Health didn't go down on that Friday. We remained operational, though at a limited capacity, and then we had fully restored operations the following Tuesdays when we called the all clear. And that was due to us balancing that need and leaders making the correct decisions of what we can do to restore operations and then what we need to do to make sure we recover from that restoral.
Let's talk about one more thing that's not up on the slides just yet. It'll come a little bit later in lessons learned, but I think it's important to call this out, is your need to practice your downtime procedures with your operational friends, right? You know who the best folks in healthcare are at going back to I call it going back to the 80s, because when IT is unavailable, that's essentially what you've done. You've gone back to the 80s because there's no technology available to you in this case, and everything goes to paper downtime. And you know who's the best at that in hospital operations or healthcare? Anybody want to take a guess? Huh? Medical records? Yeah, they've got to deal with a lot of paper. The folks that are the best at downtime in hospital are third shift. Second shift and third shift are generally your best folks at hospital downtime. You know why? Because that's when IT loves to do all their downtime work. And they have to practice it. They have to do it all the time. You know who's the worst at it? Day shift. All the ambulatory folks. Everybody that works 8 to 5. They don't even, we have what's called red books, and they have all the downtime forms and whatnot. Some of them, it's very hard for them to find the red book, right? Because in some events, our BCAs get impacted for Epic for the downtime computers. Like all of our downtime computers were down or got blue screen. So being able to partner, and that has been very much an awareness at UVA Health and a journey we have started that we'll talk a little bit more during the lessons learned. But one other thing here, and I'll point out the guarding the gates while there is controlled chaos within, that was probably my second or third call to Aaron. was, hey, we don't want to be so focused within that we allow someone to come in when we're at our most vulnerable, right? That is definitely something you want to have a plan for and call it out in your incident management team from your information security policy. We had people calling our help desk saying they could offer help. Just download a file. Won't be bad. Just, here, try this. This will work just fine. It'll open up everything and everything will be great. So we did have folks calling in. We had folks calling our leaders saying, hey, we'll be happy to help you. Let me tell you, and this is the God's honest truth, everybody that could help us at that point had already been called away to someone else or were dealing it within themselves. We were on our own. We all were on our own in our little bit of environment right then that day, right? We partner with NTS. Their folks were dealing with their own issues internally. There was no cavalry that was coming. We had to be able to respond and react ourselves. So being able to watch the gates on the outside, communicate that, hey, don't let anyone in that's not supposed to come in, and making sure we had folks that were dedicated to keeping the bad things still on the outside rather than letting them on the inside was extremely important. We've already kind of talked about this a little bit, but here we go. So we're going to talk a little bit about this scenario. And this was the event that we all lived through, right? If you did not have that particular vendor in your environment, you didn't have to live through it, but most of us did. And it was just a poorly tested update that got pushed out into our environment. I know there's a lot more intricacy that goes along with that. Okay, I'm going to acknowledge that, but this was the best way I could sum it up for a slide. And it caused our machines to blue screen at a rate faster than we could reasonably become aware of a root cause and stop it. That happens, right? A Windows update can do that. Anything you want to add to that? You good? Are you sure? Just want to make sure. All right. So what have we learned from this? Dwayne?
I got to give it a delay. I apologize. There's a delay. We've already talked about the culture, right? Culture coming together, ready to respond to an incident, fostering that culture with inside and empowering your people. Those are some of the most crucial things that I can pass along in this. We had people that were responsible for remote locations, and they owned it. They grabbed their team. They went and conducted all the updates and deleting the files that they needed to do, and then they report back, right? You empowered your people to go out and do what they needed to do. We talked about the ingenuity already, allowing them to create creative solutions, allowing people to surprise you and work through the environment. If you can foster that culture, like I said, we had over 200 some odd volunteers out of 400. That's phenomenal in my mind. And they volunteered their weekend. I know people that were working 19 hours. Myself, I worked something like pretty damn close to 24 hours in a 32-hour window or something like that. There was a lot of people volunteering their time, showing up for shifts, being on site. We had our CTO fixing computers. He was walking right alongside with me and doing updates on computers once command and control is in place. So it's fostering that culture, and it's bringing the people together to allow them to know that they can make a change.
Absolutely. I'll tell you, it was good to have the grace from the medical staff too, right? And that communication to be able to do it. I'll tell you just a fun story real quick about this, because everybody needs a little brightness in a dark, cloudy day, right? We had 290 people that we had conscripted across the organization. We assigned one desktop PC to every team, and we sent them out to different floors to work their way down and work their way up. And they meet in the middle. And they all had USB sticks, and that's the way we ran it. And somewhere along the way, one of our groups found a bright pink or bright yellow sticky note pad, and they took it with them. And as they fixed computers, they wrote a little smiley face on it, and they stuck it to the machine. And our clinicians, when they came in the next day and saw the little yellow or little hot pink sticky note on their PC with a smiley face on it and everything was working, they were so thankful for it. They called that out to us. And we in the command center had no idea it was going on. It was just something that organically created itself. So that calm under pressure, that ability to think through and be able to brighten someone's day, even in the midst of a dark event, is what really why we do a lot of the work that we do. It goes back to that culture. If there's nothing else you leave here today from this presentation, it's about culture, because that's what your ultimate resiliency is going to be in responding to these events. Is, are your people motivated? Are they willing to put in the extra time? Are they willing to put in the hour? We had people from UVA University coming over, from the IT teams over there. I had them show up. It's like, we're here to help. We had a training room on the next room. We had our training department in there. They were training people how to use the USB sticks. Sent them over there. They got trained within 20 minutes or so, and we sent them off to the floors. And I had more folks from all over the organization coming in and wanting to be a part of that. And I think that says a lot about the culture you create. That morning we had 200 people out the door at our main IT facility. We couldn't get them out into the organization fast enough. So that's really what we want to raise awareness around. And the last thing, and this is probably the thing where Dwayne and I can give you alternating reviews on, is it might not be such a bad idea to maybe have a different product in your data center than you have on your endpoints. Okay? Not such a bad idea. We always talk about consolidation, right? It's cheaper, it's more economical. We had Semantic EDR in our data center, and we had CrowdStrike on our endpoints. I didn't have to worry about my data center. My data center was a beacon glowing in the sun, waiting to be used again.
I, on the other hand, was up for 14 hours patching servers. We had 20 different people trying to figure out which servers were down because our monitoring tool wouldn't show because it was stuck in a limbo state, so it wouldn't show us what's down. So I had 3 individuals individually logging on to all 1,400 of our servers to find out which ones were blue screened. And then from there, we were finding the bypass to get in and delete the file that was bad. So yes, we had 2 very different experiences from a server standpoint.
I just had to fix computers. And I talked a little bit about this, resource mobilization for all hours. I think IT usually does a pretty daggone good job during the day or while people are awake. You can get folks on the phone pretty easily. Getting ringers to ring and folks to answer the phone when they're dead asleep or whatever, that's a whole different ball game. And having their full and updated contact list, whole different ball game. That's something we're actively working on to make better because we learned that was a big pain point for us. And that could be for any major incident that's happening at night.
I can tell you we had, I think, almost 30 people on our incident management call within the first hour. And that's the responsiveness that we were able to get from our team. But that resource mobilization is correct. From the time that we got started to get people fixing servers, from the time that we got people on site fixing the computers or the endpoints, that mobilization was paramount. And it goes back to we practiced. We knew what our incident management process was, and we had people ready to respond.
The next word that comes to mind for this, and we're almost done, I promise. The next is partnership. I say partnership a lot because partnership with operations becomes your next best friend. Understanding what they're going through, where they need. It wasn't IT for us deciding where to go. Okay, we took our direction solely from the folks in the command center, hospital command center. They wanted us to prioritize the ED, followed by the ORs. Then they wanted us to get lab, and then we started working on ICUs and down to the floors. Right? Within 12 hours of notification of the event, we were back off downtime.
Same thing with servers. We were getting the same exact stuff. We want blood bank backup. We want radiology backup. We were getting that prioritization from our leadership, exactly what they wanted to get back up, and we wouldn't have got that if we didn't have the partnership already.
Yes, and you want to talk about that ahead of time, right? These are things that you want to, if you can tabletop these things out, that's great. And I think what I've seen from our own teams at UVA is our operations teams are more willing to work towards downtime testing and practicing and talking through the hard things more so than before these types of events happened, right? Never happened to them 15 years before. Why would it happen now, right? Well, it only takes once. And we got the once, so now we're talking about it. And we're going to be better for the next time. Because in the end, we want our patients to walk out of our doors better than when they came in the doors, right? And that's our whole focus, and that's why that partnership is so clear or so needed.
The last thing on partnership I'd go over is make sure you have partnership with either your outsourcing team or your supply chain, whoever handles contracts. So establish those clear SLAs with your vendor is paramount. I don't know how many times I've been told, well, we're going to manage you to your SLA, and you want something up right then and there, but your SLA says 2 hours uptime. You're going to get managed to that SLA. So make sure you have clearly defined and established SLAs, and you demand transparency. So that's that partnership with either, like I said, your outsourcing team, whoever helps you look at the contracts and make sure everything is where you need them from a vendor and the relationship with your IT team.
And it is a relationship with your vendors too, because any of your third-party vendors can have the same bad day that we had back in July. I think everybody should acknowledge that and be open to that. You just don't cut off a relationship because one vendor had a bad day. One time I'll forgive you for one time. Twice, you're gone. But one time, I'll forgive you. And we have to acknowledge that we have this risk anywhere, many different places within our environment. We still are going to use the same vendor profile that we used before. We just know how to react and respond a little bit better. And we can have a little bit more forethought in how updates are applied to our environment so that we can try and prevent as much of this as possible. And with that, what questions do you have? Or what can I answer for you?
They just want to go to lunch.
I know.
You talk about setting up your operational center in the cafeteria during the event. As part of your lessons learned, are you looking at possibly having a dedicated placement, or is that just going to be go-to?
Ours wasn't it's in a building right next, or a room right next to the cafeteria, and that's actually designated as our incident command center. They have tables set up in there already, the jacks already, and they don't use it for anything else other than into command. And we'll spin up, like I said, field services will bring field services manager. So he brought, it's
So ours is standing. We have one right next to the ED. It's a hospital command center that they will activate for any number of reasons. And they'll have an all-call emergency management, and that's where we call them AOCs, or administrators on call, for all the different specialty areas, IT included. They're required to report to that command center as soon as possible and also be on the call until they get there. And then from there, depending on the scope, we'll stand up an IT command center, and that's in our IT environment. We call it Stacy Hall, where our data center and whatnot is. And then once those two command centers are in coordination with each other, if we need to bring in more, we had several that we had to stand up. We actually, for the CrowdStrike event, one of the things that worked really well for us is we created drop-in centers or mini command centers. In the cafeteria, in the dining room, conference room there, people were bringing their laptops and PCs, and we staffed techs there to fix things. So if they didn't get caught in the roaming squads, they would get caught there. So it was being flexible. But we generally always have a hospital operations stays always equipped, always ready to go. And then we'll stand up IT command centers as needed and mini command centers as needed. Flexible. Tabletops, yes. Being able to talk through those things, yes. We just did a technical tabletop for our ransomware environment for our technical teams this past. That was enlightening, right? Especially for me, for a new CTO. It was great to see how people would respond. But partnership with the vendors, we're actually talking to IGEL back there about how we can create a subset of disaster-ready computers in our environment that can flip over and boot into the data center for a Citrix desktop. To be able to get the immediate need back up and running. And then they can move on with clinical operations, and we can kind of repair at a much different pace than what we had to repair before. So it's about kind of looking at those things, taking the environment as you're presented and the problems, and then reacting and coming up with new solutions to move forward. But yes, practicing is something we definitely do now. Good?
I can talk to you guys. So.
Oh, absolutely. Thank y'all very much.